Hello, my name is Mike Reed, and my group is Janice Pearson, Casey Haynes, and Camille Culbertson, and we are talking about cholera in Kenya. Grace Mumbre, an international lawyer who lives in Kenya, was asked what could be done to help the cholera outbreak. She stated that further education and sanitation could help. I remember when the government got involved and there were lots of advertisements and campaigns about malaria. People actually took heed and protected themselves.
So the bacteria Vibrio cholerae is the problem. And I'm sorry, my name is Janice Pearson. Cholera has been around since the beginning of man, but it has been eradicated in most of the modern world. Unfortunately, there are several developing countries that are still plagued with this disease. As you can see from this slide, the disease does not discriminate. It doesn't care about socioeconomic status or title. And as we learned from the Kenyan international lawyer, Grace Maburu, she says, cholera is deadly. It's killing people really fast. And yes, clean water is becoming harder to come by in the main cities. The current outbreak is in the capital city, Nairobi. And the funny thing is that this outbreak has affected people of all classes, including parliament, she mentions. So cholera is an acute diarrheal infectious disease caused by the bacterium V. cholerae, and it can be fatal. It's transmitted through the fecal-oral route, contaminated food or water, and although it does not discriminate its victims, there are certain populations that are more at risk than others, such as those living in the peri-urban slums and refugee camps. The very young and the very old are the most prone to the mortality rate of this disease. The signs and symptoms appear 12 hours to 5 days following exposure, and they include the sudden onset of extreme diarrhea, which is often described as rice water, for hours, rapid heart rate, dry mucous membranes, low blood pressure, muscle cramps, irritability, and finally shock and death in the worst cases. In this picture, you can see some of the effects of cholera, especially on the very young, and it's infants, children, and the elderly have the highest mortality rates from this disease.
Hi, this is Camille Culbertson. We believe that education will be the most effective way to prevent the spread of cholera in Kenya. What we've done is we plan to have a series of 4 classes with the topics of water purification, hand washing, food hygiene, and simple septic systems. Each of these classes will run about 60 minutes in length. And since we don't know the ins and outs of each city or village in Kenya, we've made our program flexible to best adapt to each of the place's needs. These classes can be presented in one day, over the course of weeks, or even over a month. And there's an order to these classes, so we'd like to present that to you, starting with water purification.
Hi, my name is Casey Haynes, and I'm here to talk to you about clean water. Purification of water is needed now. This is not something that can be put off to the future. Just look at these facts, how they're presented. 80% of patients go to the hospital over preventable diseases. 50% of those illnesses are created by water, sanitation, and hygiene related. Water Ministry of Kenya announced in September of 2017 the building of 28 new water and sewage systems throughout the country. People are in immediate need of clean water now. Water purification can be a simple process. It can be done with just adding a few drops of bleach into a liter of water, or if bleach is not available, you can use fire to boil the water and sterilize it that way. This picture of the wapi is one way that you can boil the water for sanitation. Another system that's another ideal and inexpensive way to provide purified water is with the Purify Water Gravity System. Find 2 buckets with lids of any size. Clean out the buckets with bleach to kill any harmful bacteria. You can purchase 2 water filters at very low cost, or seek out your local water leaders who should have access to them, to these for a donation to the community. And install as described above. The system can produce thousands of gallons of clean, usable water All that needs to be changed are the filters about every 500 gallons, depending on the quality of water that is put into the unfiltered areas.
In talking about the spread of cholera in Kenya, Dr. Lanai, County Public Health and Sanitation Director, said that hand washing with soap is a self-administered vaccination. Preventing the spread of this disease can be greatly controlled through hand washing. This is well known throughout the country, but a new emphasis is being placed on washing hands with soap. During the celebration for Global Hand Washing Day this fall, Nairobi County Deputy Director of Public Health said, if we wash our hands, then 98% of all the cases will be dealt with. So when should you wash your hands? This is something we'll talk about during our first class. We'll focus on those critical times that the spread of cholera is more likely to happen, like using bathrooms, dealing with food, touching animals, and caring for the sick. We'll also focus on how to wash hands properly. Using proper techniques right off the bat will help the habit of hand washing become more effective. And as those who've taken our classes teach others who could not attend about the proper way to wash hands, it'll become sort of a self-administered vaccine to lessen the chances of their contracting cholera.
So then the next part of our education will be about food hygiene. Kenya has a Department of Public Health which manages the food safety regulations and oversight. However, the majority of the contamination problem lies with the informal sector of the food industry. 80% of the food supply to domestic markets comes from this sector where hygiene controls are rudimentary. Because poverty is so widespread, food consumers do not have the resources to hire or buy food from formal sector vendors. Regardless of income, foodborne cholera outbreaks can be stopped. Teaching all food suppliers the 4 easy steps of food handling, which are, or food handling safety, which are clean, separate, cook, and chill, can break this cycle. The clean refers to washing hands and surfaces frequently. Separate refers to keeping uncooked and ready to eat foods separate to avoid cross-contamination. Cook means to cook all meats, eggs, and dairy products to a proper temperature, and chill refers to refrigerating foods properly to keep them at a safe temperature.
The next portion of our education is going to be an aseptic system. Aseptic systems are important because it prevents human waste from contaminating water sources, particularly surface water sources. That way they can be treated through chemical means of bleach or through mechanical means of using natural filter process through the earth. So a septic system at its core has 2 chambers. The first chamber holds the solid waste until it can be broken down to a liquid, and then can go into the secondary tank that further breaks down any remaining solids. And then finally, the liquid goes into the small pipes that allow it to leach out into the rocks and soil. The first step in this process is to dig a trench. The second part of this process is to cut holes as shown above in my images. I have detailed description on each one of these slides, but we will go over those in more deep depth during the training. It is important to make sure that you properly fit. If the system is leaking prematurely, there's no purpose in having a system at all. And next, the final part is to construct and organize the barrel in a proper order and function, ensuring that you have a proper fit. And one of the most important things is going to be making sure you have the seal. Following which, you will then have the feeder pipes that take the liquid from the final barrel and distribute it out into the soil. It needs to be distributed over a greater length to ensure that you are not just creating a muddy pit. Also, it's important to remember or know that toilet paper can be hard to dissolve. And you can test this by adding your toilet paper to water and see how quickly it dissolves.
Integration is the solution. So why will integration of this program make a difference? Clean water is needed now. Purifying water is a key element to limiting the cholera outbreak. These water systems and the knowledge of how to build them must be spread across the areas of need. These communities deserve clean water. This simplistic system can provide it now, while waiting for permanent systems to be built in the future.
Hand washing prevents the spread of cholera and many other diseases. This simple fix is among the most effective and the least expensive ways to prevent cholera.
Cholera is a foodborne illness, and food hygiene is imperative to preventing the spread of this disease. According to the World Health Organization, consumer education of food safety will prevent foodborne illnesses. With implementation of this program's education component, both vendors and consumers will be given the tools to keep food safe.
It's important that we use septic systems for proper sanitation to prevent the disease from contaminating water sources on the surface. Septic systems can treat through chemical and mechanical means.
To implement this program, we plan to work with local officials to figure out how to tailor it to their needs. After we meet with the local leaders and public health officials to present our program to them, we'll assess their needs and talk about the best way to work in their area. We'll ask that they assign an ambassador to the program who will work with us and help us understand their community's culture. As we work with the program ambassador, we'll teach him or her the ins and outs of the program so that they'll be able to teach the program locally in the future. This person will be our contact as we follow up in the community with any needs they may have in the future, in the weeks and months following the program. We're encouraged that our program may be successful by the progress of other programs that other programs have had in Kenya. Moving Mountains Kenya, for example, has done a great job working with local officials to bring programs covering healthcare, education, personal development, and social welfare into the counties in Kenya. This NGO would be an excellent one to gain insight from and possibly to work with to implement our program.
Studying programs that have been successful in other areas can enhance the efforts of this intervention plan. A great example is the cholera epidemic, which plagued Latin America in the 1990s. Learning how the epidemic was finally eliminated through implementation of water and sanitation systems gives validity to this proposal. Administering cholera vaccines, which have proved successful in other outbreaks, would be a prudent addition to this response plan to buy time until proper sanitation systems are in place. And in conclusion, we hope that through this program, we hope to decrease the incidence of cholera in Kenya by 50%. We appreciate you listening to our program, and we thank you for your attention.